Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about staying encouraged when you are out looking for your first job in medical coding. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, I got a comment. I'm going to read it first and then we're going to get into it. So here we go. The viewer says, I'm going through looking for a job right now. I'm trying to appreciate the struggle, but these rejections left and right are like punches. LOL. Yes, in the beginning, when you are looking for your first job in medical coding, it is going to be taking a lot of hits on your ego. It is a lot to put yourself out there, number one, to be in a brand new career field and, taking all this rejection after you've worked so hard to get your certification and to get through the school to begin with, right? And then you're hit with all of these tests and all of these requirements, and everybody wants experience, but how are you supposed to get experience if no one will hire you, right? So I hope that you will take some time to look through my videos once again, because I've done a lot of videos before about encouraging people to just continue to apply. And when you're applying, that you still want to apply for those positions that are asking for 3 to 5 years of experience. And you're going to apply to these because you have the training. Now, they're going to say that they want 3 to 5 years of experience because they don't want to have to train. However, if they do get desperate, that's when they will say, okay, we're going to go ahead and look at the new people that are applying, and we're going to go ahead and give some of these assessment tests so we can see where these people are. Now, they give assessment tests because it's important to find out what the skill level is of the person that's coming in. This is why it's very important to do very well on your assessment tests when you are, applying at these places. And yes, sometimes they will tell you what you missed and sometimes they won't. And sometimes they will say it's a pass-fail thing. And you may have made an 80 or an 85 or maybe even a 90, and they can tell you that you still failed, because the standard of which they need you to be is a little bit higher than what you missed on your test. So that's the thing. It's not personal, okay? So that's the first thing you got to do, is look at it like it is not personal, because it is not. This is a business, and health information is an industry that requires a lot of skill and a lot of knowledge. And sometimes it takes a few runs at your target in order to be able to get in. Now, I have suggested before to apply with a temp agency, and a lot of people ignore me when I say this. I'm telling you now, this was how I was able to get in, because I was at the same position as all of you out there looking for a job. I had looked for 2 solid months and wasn't finding anything, and nobody wanted to give me a chance. And I would get these interviews, and I would talk with the people, and I would have these assessment tests, and they say, well, you did really great, but we have this stupid rule at our facility that says we can't hire anybody who doesn't have this amount of experience or whatever. I've heard that a couple of times. But to me, it's just like, it's stupid because somebody who has years of experience can be very narrowly trained, because sometimes they just stay in one place and they get comfortable there, and that's where they stay. And so they don't have skills and they don't grow their knowledge. Whereas a brand new coder is fresh off the street, no bad habits, and they have a lot of training, hopefully, or they have a lot of study time in. Because even if you're going through a fast-paced medical coding program where you feel like you're not learning, it doesn't mean that you don't need to learn on your own. You do. There's a lot of things that we have to learn on our own as medical coders. This is part of the field. This is part of the industry, because we can learn this from books. And that's why a lot of people do learn, the ones that apply themselves really do learn from books. So you will get stronger after a while. You will get more confident, but you do have to put in the time and the work learning it in order to get more proficient at it. So when you're out there and you're applying, set your expectations to realistic expectations. If you go in there expecting that you're going to get hired and you're going to get thrown all this money right away, you're setting yourself up for disappointment. All right? So let's keep our expectations in check when it comes to what should we expect. Now, in your local area, you can go to the Department of Labor or the Bureau of Statistics and find out what medical coders make in your area, because every area is different. And so that way you'll know when you're applying at a place that you won't think that it's, oh, the pay is so low, or I was expecting higher. What you start at is not going to be where you're going to stay at, obviously. When I first started and I got registered with a temp agency, they got me my first position. It started off with a really good rate. When I left there at the end of those 3 months, because it was a 3-month assignment, because they don't call medical coders in for one-day assignments, okay? So when you're thinking that you want to ignore me when I suggest that you go to the temp agency, oh, because there's, you know, those are just one day here, one day there. It's not like that. Typically when you're getting an assignment from a temp agency, it is for like a contract, or it is for a particular amount of time. So that's something to keep in mind. But when I left at the end of those 3 months and I went on to my next assignment, I got a huge bump. This wasn't just a little bitty bump. This was a huge bump in my pay. And so I'm like, okay. So it was really awesome to start seeing that money coming in, but that wasn't my focus. And so again, setting those realistic expectations, my expectation was I wanted to get in, and I got that expectation fulfilled. Okay. And my second thing was I wanted to get closer to home. I wanted to move back home because I had to move. I had to move. Don't tell me that you can't move. I'm telling you my story. When you are starting in this field, sometimes you have to move. I moved. Not everybody can, and please don't tell me I can't move. I know not everybody can move, but this is my story and this is what happened to me. So when I moved and I went to this hospital and I was there for 8 months, I was still actively applying to the places that I wanted to go at my hometown and any place that I could get close to my hometown, because that was my goal. And again, setting my realistic expectations, I knew I did not have a year of experience yet. I had only had a few months of experience. I had the 3 months plus, you know, being in the hospital. At the time, I got my first interview for a place that I wanted, which was my forever home now. I was 6 months in, right? And so then I was like, okay, this is awesome. I can do this. This is 9 months into me starting as a medical coder. And then I went through that interview process and everything. I took their test. I did very well. This was a good interview, and they didn't call me. But I didn't give up, because again, my goal and my why was to get back home. And being here at my forever home now, it was going to get me a heck of a lot closer than I was. So that's why I was like, okay, well, I'm just going to keep trying. And 2 months later, when they didn't call me back, I ended up applying again because they opened up another position, but this was a higher position. So again, being persistent and just going after what I wanted and having that goal mindset, even though I know it's very hard to have a goal mindset, especially when you keep being told no. One of the things that benefited me though was I'm a very good writer. And having a good resume, because your resume is going to be your mouthpiece before they see you. If your resume, you're sending it out, it looks all crazy and it looks like, you know, you don't know what you're doing because, oh, well, Blue, I'm just starting out. I don't know what I'm doing. But if you're not listing your skills that you learned in the school, ICD-10-CM, CPT, HCPCS, if you learn ICD-10 PCS, that needs to be on there. If your name is missing your credentials at the end, again, you're in the wrong, because that's why people's resumes get passed over, because they don't put their credentials next to their name. They put it all the way at the bottom like it's an afterthought. When they're looking at you and they need to see immediately, what are you? What do you identify as? What is your credential? What are you presenting to them? And it needs to be very clear. It needs to be to the point. It needs to be, okay, these are just the highlights. And you need to make your resume no more than 2 pages. All right. If you're sending out 3 or 4 or 5 page resumes, which I see all the time on LinkedIn, and then they're upset because they're not getting calls back, that's why. Because when a hiring manager sees a 3 and 4 or 5 page resume, sometimes 6 page resume, they know that you're wasting their time, because they're not going to sit here and flip all those pages to just find out about you and then see all the way at the end that you have a credential or that you finished a program. So make it easier for these people. Tell them what they need to know about you, all right? And you can find out what they're looking for specifically in those job listings. And don't indiscriminately send out resumes thinking and just hoping that somebody's going to call you. Because again, that's not showing detail. And these managers, they look at the detail. You know, I'm a very detail-oriented person as a medical coder. I know how important it is, you know, and I've studied parts of leadership. I know how important details are. If I'm a hiring manager and I'm looking at resumes, I want somebody who's going to be very detailed. If you send me a resume and it says, I know ICD-10, immediate rejection. Why? Because you didn't tell me if it was ICD-10-CM or ICD-10-PCS. And do not assume that I know what you're talking about. So that's the mindset you need to have when you're looking at your own resume that you're sending out. Give the people something to look at, not just something that you copied off the internet, not just something that, you know, you just threw together and didn't put any kind of thought into it. Look at the job listing and incorporate some of those skills and things that they want the person to know into your resume. Make sure that it's in there. So that way, okay, we have somebody who really understands what's going on here. The job title needs to be in your resume that you're seeking whatever the job title is. All right, guys? And it's not just about being a medical coder or, oh, I want to only work remote and I only want to do things. A lot of people are doing that. And again, it's setting people up to fail when they get so insistent on this is what they want, and then when they're not getting it, they get very frustrated and they start feeling those punches of, you know, oh, you know, the industry isn't calling them, you know, they're not finding a job. Let's set it up where it's much more easier, where there's winning on both sides. You may not be able to start out right away as a remote medical coder. I'm going to be honest with you. I'm going to be very straightforward and blunt. You may not get what you want in the beginning. Now, sometimes people can get a remote medical coding job because the pandemic changed how new medical coders are hired. There are some people who are brand new who start remotely at home. It does happen. However, it doesn't always happen. So I want you all to set yourself up for success and be willing to start in a place where you have to physically go, all right? It's not always a glamorous thing to be at home remote medical coding. Book coding and real world coding are two different things. Electronic medical records are completely different everywhere you go. And even if two facilities have the same electronic medical record, they don't always have the same package, okay? Because packages can be different based on the facility, based on the size, and based on, you know, what kind of facility it is to begin with. So that's something to keep in mind. But the goal, again, is to get in. And let's get realistic on our goals. Okay, well, if we can't get hired as a remote medical coder right away, let's try to find another way to be able to get in. And sometimes they're not always called medical coders. They're called other names: health information tech, health information technician, medical records technician. They're called all different kinds of names. So I really encourage you all to take the time to go to whatever search engine you're going to for job searches, and you take the time to put in medical records, health information technician, medical coder, coding. Just use different words so that way you can see different positions that will pop up. And so that way you can start, okay, prior authorizations is another really good place for brand new medical coders to start, because prior authorizations involves a provider bringing you a medical record, or however the process goes, but this is the way it goes, kind of. You get a medical record and the provider says, I want to perform this procedure on this patient who has this diagnosis. Call the insurance company and see if you can make it happen. Will they pay for this? Okay, cool. And so you go through the documentation, make sure that what they have supports that procedure. So that way when you're talking to the insurance company, yes, the patient has this, this, and this, and these are the diagnoses that the provider says warrant this procedure. Okay, that's giving you some exposure to coding. It's not necessarily coding yet, but it is giving you some exposure to coding. Medical billing is another alternative position that you can start in. Now, a lot of people say, well, Blue, I don't want to do billing. I understand. I've never been a biller. I've always been a medical coder. But so for some people, they start their careers as medical billers. Then they transition over to medical coding. Because again, that medical billing side is giving you that exposure to those codes. And you're going to be able to see what is the insurance rejecting. What are they looking for when they're looking at the documentation. So that's something that you want to make sure that you are doing. And let me, hold on. I almost lost my recording there. I had to plug in my phone. But as I was saying, you want to make sure that you are giving yourself this opportunity to be able to start in alternative positions like medical billing, because you're going to get exposure to those codes. You're going to see what the insurance company will be looking at and what do they deny, so that way you can start looking at the documentation and matching up how the codes are going and things like that. So that way that it's more experience for you to add to your resume. So again, the whole thing is getting in. You want to get into the facility. You want to get into a company somewhere, getting into medical coding. But it does take time. There is a thing out there that says for every $10,000 you expect to earn in salary, expect to be looking for 1 month of time, okay? So the more time, the more money you expect to make, the longer it's going to be for you to find a really good job that you want, okay? So that's something that you have to keep in mind, all right? And again, setting realistic goals will help you in this. If you are proactively getting out there and applying and looking for just different positions, that's really good, because then you're broadening your search. But really getting involved with a temp agency, and that temp agency is going to be another person that is going to be helping you in your job search. Because if you're working, the temp agency is making money. And we all like to make money, right? And so if you tell me, well, Blue, I have a job already, but I want to get into medical coding, this is just an alternative, guys. It's just an alternative to starting, all right? If you want to continue to apply for places, that's fine. But for those of you that are not working, the temp agency is the way to go. When I was looking for a job, I still worked multiple jobs so that I could support myself and be able to take care of the bills that I did have. So that's something that, it's not a reason to not work, guys. You have to work. I mean, everybody has to work. So you can still apply for these jobs. I still applied for those jobs. I still apply for medical coding jobs. And the more that I worked in those jobs, because I was working minimum wage. So working at a halfway house, I was working at a bar, I was cleaning houses and, doing all kinds of things and trying to keep my head above water financially, So if I can do that, that was the thing that was just like, working in the bar, I was just like, I'm so tired of being around crazy people that talk to me all kinds of crazy ways. And I just have to take it because I'm working here. And I didn't want to do that anymore. So it was just like, okay, I'm just tired of this. And so, on my mom's encouragement, I went back to the school, and the school was like, okay, well, I have a friend that has a temp agency. So, but that's my advice, guys. You can stay encouraged by making those little goals and being able to say, okay, well, I reached this goal. My goal of, the week was applying to 10 different places and making sure that my resume was specific to each one of them, right? And taking advantage of the cover letter. The cover letter does not need to be a regurgitation of your resume. It needs to be that draw, those regular skills that you have that are not on your resume. If I'm a hiring manager and I look at a resume and the resume tells me under the skills that you're organized, you're a people person, again, I'm going to reject that resume, because that's not a skill. That is a skill, but it is not a hard skill like the coding is. And that's what I want to see as a manager. I want to see that this person understands that I need to tell you about the coding skills that I do have. All right. So your cover letter is going to be the draw, and it's going to be what's introducing you. It's going to be that grab. It's going to be like, okay, this is what I have to offer. And again, it's not a regurgitation of your resume, but it is going to say a little bit more about you. Then you can say, yeah, you're a people person, and you know, that kind of thing. That's fine on the cover letter. And please don't write in and say, well, I don't do cover letters because no one reads them. They do read them. They do read them. But if you're going to send out blanket ones that are just like templated, oh, I am excited and looking for a new place to work, and I want somebody to train me. Again, that is going to be the reason that you're not going to get a call back. Nobody wants to see that as, oh, well, we need to train this person. Because it's about, okay, this person is new, but they know how to do their research, and they're going to be able to, you know, learn and how to do these things and ask for help when they need it. But they're also going to be very independent. That's what they want. They want a lot of independence when you're working as a medical coder. So that's something to keep in mind, guys. Be very clear on that. And that's just my advice anyway, guys. But don't give up. The people that give up are the ones that are never going to get in. But if you stay persistent and you stay with it, you will find your job. And again, if you take my advice, I have so many videos, guys, about resume tips. Take advantage, guys, because that's free information that I give out, okay? That I don't ask y'all for nothing when it comes to those tips. They're there for you all to look at. The alternative jobs that you can apply for as a medical coder. Again, it is free information for you all to peruse and look at and things like that. And it's there to help you, because when I was coming up, there was nobody like me, and there's still nobody like me. But you know, that's something that, you know, I do because I love the field, and I want people who get into the field to be successful, and I want them to learn how to do the research, and I want them to be successful in that okay, well, I didn't know how to do all this stuff before, but now I know. All right, I know to go to the temp agency. I know to be patient, and I know that I have to keep applying everywhere. And I know that I have to kind of set my sights on a more realistic goal and not just insist on the things that I want, like remote medical coding and that kind of thing. Remote medical coding will come with time, okay? But again, the goal is to get yourself in that facility and get yourself working. That's the goal. But it will happen as long as you continue to study and you're able to pass those assessment tests, and you accurately tell the employer what it is that you can do. That's the people that get in. And that's my advice for today, guys. Stay encouraged. Do not give up, because you didn't give up when you got to the school. You did not give up when you completed your test and passed your certification exam. This is not the time for you to give up. This is a time for you to dig in and keep applying. Okay, that's just my advice anyway. So if this video helps you, I hope that you will like, subscribe, and share. Remember, I will be live on Friday, 5:30 p.m. Pacific Standard Time, 7:30 p.m. Central Standard Time, and 8:30 p.m. Eastern Standard Time this Friday. So I will see y'all then. Bye.